Hello, this is Claire Gibbs. This is going to be my video submission for the self-reflection for on-campus internship. My disorientating dilemma that I'm going to use for this self-reflection is going to be a time when I was in on-campus internship, and I was treating one patient, and she was a African-American woman, probably in her 30s, and she came in with a complaint of low back pain. She was in great pain. She was also rather on the heavier side. Had many folds of skin. She was very heavy. The treatment was assessment went okay. She had high blood pressure and complications with range of motion. All stuff I would have assumed. In treatment is when we got to the dilemma, though. While treating her on her back, I ran into a problem where, while getting into her low back, due to her having skin folds, it was difficult to gain access to the muscles through just massaging through the regular skin. So to try and accommodate that, I attempted to kind of press open the folds that were made by her adipose tissue, creating the folds in the skin. So as I was doing that, though, when I opened the area, a rather potent smell came out, and it was very disorientating, to say the least. As well, I also discovered what could have been. It was some kind of whitish yellow substance, possibly mold. I'm not really sure. Regardless, I was quite startled by this. I had never seen anything quite like this. I'd treated patients that were heavier in the past, but nothing quite on this level before. So I continued the treatment, though, and I didn't go so far that I touched I'm going to refer to it as the mold since I don't know what else to call it. I didn't touch the mold. Even despite the smell, I put up with it and continued to go through it anyway. And we completed the treatment, and the patient, we did her reassessment. She reported that she had less pain, which I guess was good. And that was the end of it. I guess I would say, to summarize, what the actual dilemma really was of course the combination of the smell, the mold, the rather unsanitary situation that it was, and probably embarrassing for the patient too. To analyze it, I guess I would say that I think I made a mistake in probably focusing too much on the area. I thought that, her complaint was the low back, sure, but I think it probably was, just in many ways it was, I think, unprofessional. From the fact that, for one, the fact that there was what could, something there, I'm going to call mold, was clearly unsanitary. The smell, we are in a group clinic environment, so there are other people in there, my client included, so whether that would have been, could have even been considered an acceptable experience for trying to create a comfortable environment, I don't know. I kind of doubt it. And also, I imagine probably the patient might not have felt comfortable with it. If I was in her position, I doubt I would want someone, exposing something that I myself probably wouldn't be terribly comfortable with. Yeah, I think those were probably mistakes. Why do I think that I chose to do what I did? I think I had it in my head that I wanted to fix her problem, and from what we've learned in the past, one of the most effective ways to deal with problems that revolve around sore muscles is to massage the muscles. And so I thought that the best way to do it was to get at them and to go into the folds, which I think, and ultimately due to the circumstances, I should have foregone. Um, for my personal response to it and my behaviors, I think as far as treating her, I think I handled myself decently well. I don't think I was rude to her. I think perhaps not mentioning it at all or asking her if she was comfortable about it perhaps was a mistake. I didn't want to mention it because I thought it would be embarrassing. That's something I perhaps should have done instead, to ask her or asked a teacher. I could have done a number of things, I guess, in that sense. I don't know. Looking back at it, if I had to redo it again, I probably would have stuck to more superficial techniques. I probably would have, still tried to apply pressure, but I wouldn't have gone digging into, these crevices. I probably would have stuck to the surface of the folds and tried to press in there. As I feel, even if it might not have been as successful a treatment at getting at the muscles, I feel that for the respect of the client and for sanitation reasons and maintaining a proper environment at the clinic probably would have been the more correct thing to do. For new learning needs, probably I guess it would be that I should probably also keep in mind that when situations like this come up and there's something unexpected, I should try to remind myself to not just go with whatever first comes to mind, to try and take a step back and think of the situation more clearly. I think I saw the situation and I just kind of went with my first thought and didn't really give it a second's consideration. There's definitely a number of things I could have and should have done that I didn't. And for what I can do for future times if this happens with other patients, I think I definitely did think I did a good job in being as respectful as possible for the client. So I maintained that, and I think my interest in fixing her problem was good, obviously, but ultimately, fixing the client's issue, while that is in a way number one, we can't sacrifice. If we're working amongst our peers, we can't sacrifice the entire clinic environment. We have to remember that the client is a person as well, so doing something that the client might not be comfortable with, even if it works for them, ultimately isn't worth it, even if doing something for a client might be beneficial. If they don't like it, then that's the end of the short of it. We're there to try and treat them. So, yeah. Overall, I think that pretty much sums up my feeling for the disorientating dilemma. And yeah, have a good one. Claire out.